And we're joined now by Ebru, today's medical contributor, Dr. Poonam Alaigh. Dr. Alaigh is here to discuss the addiction epidemic facing our nation, maybe even the world. Welcome, Dr. Alaigh. Now, why do you say America has an addiction epidemic?
You know, Lucy, I think it's an important piece to discuss, especially around prescription drugs, because a lot of us feel that when you're taking prescription drugs and physicians are writing those prescriptions, it's somewhat safe. And when you look at the number of prescriptions that are being dispensed that have the potential for addiction, they're in the millions. And of those millions of prescriptions that are being dispensed, we have about 2 million patients who get addicted to it, and 30,000 people who die as a result of these prescription drugs and the addictions resulting in the overdose. It truly is the #1 cause of accidental deaths, more than car crashes. And when you combine the deaths as a result of illegal substances like heroin or cocaine, we actually exceeded as a result of these prescription drugs. And so it is truly something that we have to have a handle on. These are medications that really are prescribed as a result of legitimate reasons. However, they
medications like?
Medications. So there are 3 main categories when I talk to patients. Those are those painkillers, the opioids, and those are, for example, anything that has a codeine or opioid type medication to help relieve the pain. Those include Vicodin, Percocet, Tylenol #3. There's a second category, which are the depressants, and those are the ones that you take when you have anxiety or you just want to rest your nerves, or sometimes helping with sleep aids. And those depressants are, for example, the Ativan, the Xanax, the Valium. And the third main category is the stimulants that you take as a result of, they're the amphetamine type drugs that are used for ADHD or narcolepsy. And those are also very addictive. And so those are the 3 main categories. But then you have over-the-counter drugs too. For example, the dextromethorphan that's present in cough suppressants. And also what we feel sometimes, patients coming to us and saying, well, I just need something to help get me a restful night, like an Ambien. So all these medications together have potentials for addiction.
Interesting. You talk about things that get us going and things that put us to sleep.
Exactly.
And those are the 2 big things that we are trying to do, I guess.
Yes, every day in our lives. And unfortunately, when we mix all these medications, especially with alcohol, for instance, the effects are just tremendously multiplied when it comes to side effects and suppressing your breathing and some of the reflexes that protect you on a day-to-day basis.
So in a case where you would accidentally overdose, you would take some of these medications, perhaps have a drink, and then would go to sleep and not wake up? Is that sort of how it works?
It could suppress your brainstem to the effect that your breathing actually gets suppressed. And so, again, all your defenses are all blunted, and you could overdose and die as a result of it. I think the important thing is that you have to know how to take these medications. You have to take these medications based on prescriptions, exactly how the physicians told you how to take it, the number of doses, the duration, the forms of medications, all have to be consistent.
It seems that doctors are at the center of this, and we've gotten away from that interaction that we used to have with the doctor to now you've got the doctor comes in, makes his diagnosis, and then the nurse comes in and does the rest. And perhaps it's the doctors who need to get the information out to patients more.
I think it's all of us, right? I mean, the physicians obviously play a very important role, but we really do need to understand what our risk factors are for addiction. So if I, as a patient or a person or a consumer, has had, a history of addiction to smoking or alcohol or substance abuse, that will automatically put me at a category of becoming an addiction potential. And once you have that addiction, it's a disease. It's not a choice. I mean, I can't be choosy about being addicted to smoking and not to alcohol and not to these medications. So,
but as a patient, wouldn't we assume, the average person is going to assume, well, the doctor's not going to give me something that's bad for me.
Right.
We're going to have that element of trust and says, I come to your office, doc, you're going to give me something, I'm going to take it, and we're going to assume it's good. And unless you tell us that we might get addicted to it, we're at risk.
Exactly, Brian. But also, it is the person's responsibility. So you have to be talking to your physician about what the effects are that you're seeing as a result of these medications. You have to be aware of what those effects have been. And truly, you have to be an informed and empowered consumer so that you're involved with the care. You can't put the responsibility on somebody else. The physician plays a critical role. But in this day and age when you have internet pharmacy, pharmacies and you sell prescriptions or you share prescriptions, there is a responsibility that comes to the person at the same time.
I wonder, is this a global issue? I mean, certainly it's one here in the U.S. as you've expressed, but what about around the world? Do they see this as well with the prescriptions overseas, for example?
Yes, absolutely. I mean, you see hotspots in South Asia, you see hotspots in South Africa, in Europe. This is, really a problem that's worldwide at this point. And I do want to make sure that everybody knows. I mean, if you think that you're on the medication, and there's always an appropriate indication for it, but if you have certain warning symptoms, for instance, if you're saying, well, if you feel guilty about taking those medications, or if someone's suggested to your loved one, about or questioned around taking those prescription medications, or you're just taking them just to calm your nerves or get going, or finally, if you feel like you have to cut down on those medications, those are warning symptoms that you may be becoming an addict. And if you are an addict, it is a lifelong illness. It's not something that is cured.
You can just stop the next
day. You can't just stop it. Your whole brain gets rewired, and it's something that you have to maintain for the rest of your life.
So are you predisposed to that, or can it not happen? Do you know what I'm saying?
Yeah. If you take it based on the instructions of the physician and you're taking it for short times, for the right indication in small quantities, it's somewhat safe.
Okay.
However, if you're going to be taking it outside of the physician's recommendations, it will ultimately cause the rewiring of your brain, and this is going to be a condition that is a disease, a chronic disease. It's like cancer. If you detect it early and treat it, you have a better chance of curing it.
Right.
If you wait, and on average it takes about 10 years for someone to actually seek help when you've become an addict, then it becomes a terminal illness.
So patients really have to be proactive on their own.
Absolutely.
Doctor, thanks for joining us. Always insightful.
Yeah,
and we'll see you again.
Thank you.
Thank you very much.